Insulin resistance and prediabetes are two critical stages on the path to type 2 diabetes, characterized by the body's impaired ability to utilize insulin effectively. With insulin resistance, the body's cells do not respond properly to insulin, leading to increased blood sugar levels, while prediabetes involves blood sugar levels that are elevated but not high enough to be classified as diabetes. Common symptoms include fatigue, hunger after eating, and in some cases, dark patches on the skin, particularly around the neck and armpits. While there is no single cure, both conditions can be managed effectively through lifestyle changes like diet and exercise, and sometimes medication is needed. Risk factors include a family history of diabetes, overweight or obesity, and a sedentary lifestyle. Here's a closer look at the nuanced aspects of insulin resistance and prediabetes. Pathophysiological process, insulin signaling alterations versus glucose metabolic changes. Insulin resistance is a physiological condition where the body's cells become less responsive to the hormone insulin, which is crucial for regulating blood sugar levels. This resistance forces the pancreas to produce more insulin to achieve the desired effect of lowering blood glucose. Initially, the pancreas is often able to meet this higher demand, thus blood sugar levels can remain in the normal range. Prediabetes, on the other hand, occurs when these compensatory mechanisms begin to fail. Despite the elevated insulin levels due to insulin resistance, the pancreas can't keep up and blood sugar levels start to rise. This rise isn't yet high enough to qualify as diabetes, but is above normal fasting glucose levels. Over time, if interventions are not introduced, prediabetes can progress to type 2 diabetes, where the blood glucose levels are consistently high, and the alteration in insulin signaling coupled with the glucose metabolic changes can lead to a range of health complications. Disease progression, compensatory stage versus intermediate glycemic abnormality. Insulin resistance and prediabetes lie on a continuum of metabolic dysfunction, each representing differing stages in the progression towards type 2 diabetes. Insulin resistance marks the onset, where the body's cells become less responsive to the hormone insulin, leading to compensatory hyperinsulinemia as the pancreas tries to overcome this resistance. Prediabetes, on the other hand, is characterized by intermediate glycemic abnormalities, specifically elevated blood sugar levels that are not yet high enough to be classified as diabetes. It signifies a further progression, where pancreatic compensation is no longer sufficient to maintain normal glucose levels, making individuals more prone to developing overt diabetes and associated complications if left unaddressed. Both stages offer critical windows for intervention to halt or reverse the progression towards diabetes through lifestyle changes and, if needed, medication. Diagnostic criteria: hyperinsulinemia, impaired glucose tolerance, impaired fasting glucose. Insulin resistance and prediabetes are precursors to type 2 diabetes, but are distinct in their diagnostic criteria. Insulin resistance, often identified through hyperinsulinemia, indicates that the body's cells do not respond appropriately to insulin, leading the pancreas to produce more insulin to achieve glucose uptake. This condition is commonly diagnosed indirectly through tests like the HOMA-IR. On the other hand, prediabetes is typically diagnosed through impaired glucose tolerance, IGT, or impaired fasting glucose, IFG. IGT is identified with an oral glucose tolerance test, revealing elevated blood glucose levels that are not high enough to be classified as diabetes. IFG is detected through higher than normal blood glucose levels after an overnight fast. Both these diagnostic outcomes are critical in identifying individuals at heightened risk of developing type 2 diabetes, warranting early lifestyle interventions. Risk of progression: increased metabolic syndrome risk versus elevated risk for type 2 diabetes. Insulin resistance and prediabetes are critical factors marking the path to metabolic dysfunction. Insulin resistance, a condition where cells in the body don't respond effectively to insulin, is often a precursor to prediabetes, a state where blood glucose levels are higher than normal but not yet high enough for a type 2 diabetes diagnosis. Insulin resistance can exist without prediabetes, yet it amplifies the risk for developing metabolic syndrome, a cluster of conditions that increase the risk for heart disease, stroke, and diabetes. Prediabetes, on the other hand, directly signifies an elevated risk for progressing to type 2 diabetes. Both conditions are alarm bells for proactive intervention through lifestyle modifications, such as diet and exercise, which can significantly reduce the likelihood of advancing to more severe metabolic illnesses. Addressing these conditions early is paramount in preventing a cascade of related health complications. Treatment focus: sensitivity restoration versus glycemic control management. When distinguishing between insulin resistance and prediabetes in terms of treatment, they both require a strategic approach, but their targets differ. In insulin resistance, the primary goal is restoring the body's sensitivity to insulin. This is often achieved through lifestyle modifications, such as increased physical activity, dietary changes to include more fiber and less sugar, and weight loss. These interventions help muscle, fat, and liver cells better respond to insulin. On the other hand, managing prediabetes centers on controlling and monitoring blood glucose levels to prevent the progression to type 2 diabetes. Here, the treatment might also include medications such as metformin, alongside lifestyle adjustments to maintain glycemic control. Frequent monitoring of blood sugar levels is critical to ensure that they stay within a normal range. Both conditions foreshadow greater health risks if unmanaged, emphasizing the importance of early and targeted intervention strategies.